the agenda. We'll call this meeting to order. It's the Ascension Parish Mental Health and Addictive Disorder Advisory Board. And approval of the minutes. We need April the 19th of 2007 approved. Somebody like to make a motion?
Motion.
A second.
Any objections? Minutes stands as approved. We have a special meeting on May the 10th, 2007. We need those minutes approved.
Motion.
Second.
I'll second.
Any objections? Minutes stand as approved. May the 17th, 2007.
Madam Chairman, I'd like to motion that the minutes of our regular meeting of May the 17th, 2007, with the correction of the roll call vote being added. I'd like to make the motion to approve those minutes.
With the roll call of the vote included.
Yes.
Do we have a second?
I'll second.
Any objections? Motions all stand as approved. Under the 2/3, ladies and gentlemen, I need your permission to tell you about the parish president's request on asking him to accept our recommendation for the removal of the mental health director. Can I get a 2/3?
Yes, I make a motion we get a 2/3 vote for it.
And somebody second it?
I'll second.
Any objections? On the Friday after the last month's meeting, I received a phone call from our secretary, who is absent tonight, and he asked me for a written report of why we came to the conclusion that we had came to, and I did do that day, and I took it to him, and I had it sent to all the council members, and I also had it sent to, I took it to the parish president's office and have it marked received, and I have a copy that I would like to put in our minutes tonight. And does anybody have any discussions or any questions on, all of you did receive this?
So we never received no response about this.
We have not received a response from the parish
Has
president.
that been a month now?
It's been a month, yes, sir. So do I,
Madam President, I'd like to motion that that letter be included in our minutes for that meeting.
and somebody give me a second?
I'll second.
No objections? I'm looking for my,
Is there a time frame on that, Ms. Italia?
no, sir, there's no time frame on it. We'll give him a couple more days, okay?
Huh?
We can give him a couple of more days?
It's been over a month.
Yes, sir, it has. I agree with you.
Long. It shouldn't have been that long.
Yes, sir. Public comment. Anybody with any public comments? Okay, we have our status report from the state, Mr. Ryan, and he brought us a paper.
Good evening.
Good evening.
I passed out the stats. If you have any questions, I'll be happy to answer them. If not, I just have a few things that I need to say. First of all, starting last week, our change of days in Donaldsonville, we have started on Tuesdays and Wednesdays. That's gone smoothly. We haven't had any problems from that. We haven't had any comments from the staff or from the clients, so that went well. So it's going to be going on, as planned from now on. Capital Area is in the early stages of creating an assertive community team as well as a mobile team for adults that would cover the 7 parishes that are in Capital Area. The role of these 2 teams has not been set yet, but we're in the process of discussing what we think needs to happen as far as crisis with adults in the parishes and what we expect from a crisis team, and so we're in the planning stages of that right now. The legislature has been asked to fund a crisis intervention unit that would be housed at Earl K. Long Hospital. I think I discussed this last month, but the next step in the process is the legislature has to approve the monies that would cover this, and so it's been requested, and now it's up to the legislators to decide if they want to fund that or not. This would be beneficial to all the 7 parishes because we would have a place where when we have emergencies, we would have a place to send them to that they could be evaluated further and observed. So I think it would be good for all the parishes. And last but not least, we have Gonzales Mental Health has been allotted 2 new positions. We are hiring an RN position and a social worker position. And we will be hiring these 2 positions in the near future, so anyone who is interested, or if you know of someone that's interested, please feel free to give them the Gonzales Mental Health phone number and have them ask for me, and I'd be glad to go over the qualifications that are needed and what we expect out of those positions. So, do you have any questions about any of that?
How many children do, off the top of your head, if not, give me a quote on at the next meeting
Okay.
on how many children you actually see,
How
not
ma-
only in Donaldsonville but in Gonzales and the Donaldsonville area.
Right.
Because it's I'm getting kind of frustrated. A lot of people in Donaldsonville saying parents and wanting their child for treatment, but they can't get scheduled appointments again.
Okay.
I never brought it to Mr. Tallia's attention. I never brought it to Ms. Baptiste, Renda, or even Brian, which when Brian came over the other day, I was supposed to mention it to him, but we had so much going on because there's a lot of kids in Donaldsonville not being seen.
Okay.
And we need to look at that.
Okay.
Because it's becoming a serious issue now because they're out of school, and I don't see why they cannot, be treated. Last I heard was they tried to schedule an appointment. They called and they got connected with the Gonzales Center. Okay, well, if they called and got connected with the Gonzales Center, that might was a day that, it was closed.
Okay.
Or whatever the case may be.
Mm-hmm.
But every time they try and call through, they connect them to Gonzales, and they're being asked to come to Gonzales. That should not on your part.
Okay.
I don't know if they have been seen before. I don't know if they're a new patient. I don't know. I didn't get into all that. It's just coming back to me. They're telling me that they can't get the Gonzales for treatment.
Okay.
And that's one of the main issues we had before. But
Sure.
That's why I'm asking you for a percentage.
Well, first of all, the last time that I checked, I think we have somewhere between 100 and 110 clients that are children
That's
from
the whole
either
parish, or?
from either side. That's the whole parish, and our criteria, we treat only the severe and persistently mentally ill children. So that would be children who have bipolar disorder, schizophrenia, the severe mental illness cases, not children who are having necessarily minor or moderate behavior problems. Those we would not see, that they wouldn't qualify for our services.
Who determines that? Do the doctors that they come to see you all determine that, or previous doctors would have to recommend that they be treated or be seen by you all?
Sure. Well, what happens is if someone calls in, then we would do a telephone screening. And so we would go through all of our criteria, find out why the person is calling, what kind of issues the child is having, and then our social worker would make a determination whether or not they met criteria to be seen by our agency. If they were deemed that they did not meet our qualifications, then we would make a referral to other agencies, such as y'all's agency.
I'm saying that there's new people,
Mm-hmm.
because 9 times out of 10, if they were being contacted or have made some type of contact with you or with the Parish Mental Health, they would know something. So she was like, she didn't really know nothing about it.
Mm-hmm.
She just wanted to seek medical treatment for her child. And I
Right.
asked her, did she bring him to a local physician, or
Mm-hmm.
she said no. She just said every time she tried and called the number, she got the number off of the television screen during the commercial ad.
I believe that's y'all's y'all's phone number. I don't think that ours is on the.
Well, I'm just asking
Right.
the question.
Right.
Yeah, as far as, you know,
But if
as
anyone
far
is
as how many being seen there.
anyone is interested in services and they have a problem with getting in for treatment at the Gonzales Mental Health or Donaldsonville Mental Health Center, you can feel free to give them my name and my number and tell them to give me a call. I'd be happy to speak with them.
The state have a special phone line?
In
that
Donaldsonville?
building?
Yeah, 474-2007.
That's the same number that shows up on the, on a commercial ad, isn't it?
I'm
Mr.
not sure.
I don't know. I couldn't.
I don't know.
Well,
Ryan.
that's where they got the phone number from, so I don't know, you know.
Excuse me. Do y'all see any substance abuse children?
We see
Only if they crit-
only if they're severely and persistently mentally ill. If they have a co-occurring disorder, absolutely we would see.
But you don't see just substance abuse.
We do not treat
That's why I
just
asked
substance
him,
abuse disorders.
That's why my question was that I asked him, who determines whether it's substance abuse, whether they need the treatment or not. He
Right.
explained it to me, say the
That's-
social worker, if they meet criteria.
Right. That's
I'm
a
presuming-
telephone screening by a social
Now,
worker.
what criteria, what standard they have, I don't know, you know. That's why I asked.
Well, I know some of our substance abuse is sent to us through the program we have with the DA's office,
Okay.
where we pay the bill for the DA. Now, I don't know how many of our substance abuse patients comes through there, but they have to see.
It's nothing.
That's fine,
nothing
absolutely.
Question-
It's just that I'm
education.
concerned because I'm having people on the street, citizens. I don't want to say, let me rephrase that. I apologize. Not people, but citizens,
Absolutely.
taxpayers, put it like that.
Absolutely.
In the area that's concerned about it and want their child with treatment.
Well,
And they can't get through. They can't even get through to a phone call.
they should give us a
You know,
call, and if they
get
can't,
through, they're holding them on the line. Now, who they calling, I don't know. I don't know if they're calling over here or there or whatever.
Sure.
But I did tell her, try the next day because it's open on Tuesdays and Thursdays.
and they can call that number, or they can call the.
So undoubtedly, we don't have a parish employee in the building.
They can
I don't
call the Gonzales Mental Health Center at 621-5770, and we are open 5 days a week there.
Okay.
They can ask to speak to the on-call social worker. The on-call social worker will do a telephone screening, and we will definitely determine if they meet our criteria. And if anyone has any problems getting in for treatment, they should give me a call, and I'd be happy to speak with them.
All right. And could you next time we have a meeting, could you bring me that statistics? I appreciate it if you can.
How exactly how many children?
Exactly between
I think it's
but parish wide. I don't want to say just down to parish wide.
I think it's about between 100 and 120. I think the last time I checked, which was a couple months ago, was around 100 clients, between 100 and 120 children. But I can get specific numbers if you'd like.
Appreciate it. Yeah, that's what I need.
Okay.
Mr. Ryan,
Yes.
the program, the newly formed program that you're speaking of, that's going to be so beneficial for the 7 parishes. I think I've heard a little bit about it.
Okay.
Is that the same program that Representative Roy Corsair is spearheading?
The program that I spoke about before is the health center. Now, I don't know exactly what you're talking about, but
this is supposed to assist the hospitals and
that is the federally funded health care center, which is they have one in St. Gabriel right now, and they're
Okay.
talking about putting one in Donaldsonville. That's completely different. That
Okay.
is health care services.
Okay.
They would provide primary care physicians, and they're even talking about doing some OBGYN services and things like that. General health care, not psychiatric health
Okay,
care.
and you're speaking of something on an emergency basis is what you're talking about?
Yes,
Okay.
the crisis intervention unit would be someone who comes in with a psychiatric emergency to one of the clinics and needs to be placed. We would have that would be someplace we could send them to be evaluated and observed. I think it would definitely be beneficial.
Okay, thank you very much.
Any other questions? All right, thanks.
Thank you.
All right, thank you.
The status report for the Ascension Parish Mental Health Clinic, Dr. Susan Menadol.
Thank you. If you look at your service statistics on the page 1 of my report, you'll see that I added an extra column for the year, and that's to help you see the comparison to the services that we provided last year and the increase in services. I thought that would be helpful to follow for the year.
Okay.
Excuse me.
Excuse me. Okay, the 279 is the amount of patients we saw in 2006.
No, 279 is the number of appointments. That's the difference between the number in 2007, the increase, and 2006 for the same month, for appointments kept, appointments made and
No,
appointments
ma'am,
kept.
I'm on the other,
The column all the way to the right.
the column all the way at the end over here.
That's what I said? That's it?
That
That
has-
shows the difference, the increase or the decrease?
Okay, that's a
Month by
decrease.
month.
That's a decrease
No,
then
that's
from
an
200.
increase. That's an increase in 2007 over 2006.
Can't be.
I have 2006.
2006 is an
No, I'm
increase.
talking about
Here.
this column
I know,
way over
but
here.
if you look at where we started here.
Uh-huh.
and
Perhaps
she's
the
saying
heading is
this
not-
month
is
was
not clear. I
last
can
year was
change
this
that.
month. So we had an increase this year
Oh,
of this amount.
That's the and what's the 183
That
for?
is the ones kept. This was
this
one
is-
scheduled.
We had
and
183
this
more
one's kept.
appointments kept in
I
January of
understand.
2007.
Okay, gotcha.
I wasn't sure what sort of heading to put.
Well, that was some information I was going to need to do
Okay.
the finance later on. Thank you.
Okay. And you'll see down in April, we had fewer appointments made, but more appointments kept. So we've steadily increased our kept appointments rate, which has been something we've been working on for several years. At the bottom, I included the Donaldsonville statistics for you. We still have someone there 1 day a week.
Miss Susan, on that right there, I was under the understanding that when Finns came into our building, they were going to need a counselor to see their children.
They refer to the agency,
What agency?
our agency.
And we don't see any of those.
Oh, yeah, we do.
Well, how come it doesn't show up on
It's,
here?
they're included in the overall caseload. Finns is just one of our referral sources.
I know, but okay, in Donaldsonville, we do not see one Finns patient.
I don't know where they refer them. They mostly get seen in Gonzales. A lot of them belong to groups. They just get folded into the whole caseload. Would you like us to track them separately?
Must be been some-
We talked to the people from Finns, and they told us that every child they see has to see a counselor.
Yep.
And he sees so many children in Donaldsonville that they say had to come to Gonzales, and he said they couldn't make it to Gonzales because they didn't have a way to come. And we were under the understanding that Finns was going to take the opportunity to use this since we put it in there on Tuesdays, and it's not.
We'll be glad to send somebody over in addition to the person who's already there. We don't get any requests from them
See,
for
that's
that.
one of the problems
No.
we're having now.
Okay, but we don't need to send anybody else if she's not seeing any patients right now over there, right?
She's seeing a few.
not
5
the whole lot.
orientation, 14 came to 5 different groups, a total of 14.
Oh, well, that's what I said. She had orientation on 5, so we don't know if they're going to be scheduled or taken in or if they meet the criteria.
If they come to orientation, they've been screened.
Oh, they have already been
Right.
screened.
We
Okay,
do the
so
same,
she's
we follow the
5
same
there.
procedure the state follows. They
Okay.
get screened by telephone.
Well, I
Okay.
wonder why every child that go in through Finns was told to me that if the reason why the numbers is a flip over in the numbers is because every child that comes through that building, whether it's Finns or whether it's what the other program they had in there, TAS or whatever, every child come through there will need to have some type of mental health treatment. That was told to me, not by
Be
a
evaluated
worker,
at
not
least.
by just a person there. This comes from the director and assistant director and the case workers. That was told to me. He said, Mr. Butler, I'm going to be honest with you, every child come through here need medical treatment. But the problem we are having, every time we get ready to recommend one to mental health, they got to go to Gonzales and they don't have the transportation.
Well, I
He had a
certainly be
few
glad
out
to
of
check.
the parish, and I don't know if they had some out of the parish or what. But the problem was they couldn't get the medical treatment because they didn't have transportation to Gonzales.
But we don't provide medical treatment.
That's not what I'm saying. It don't have to be medical. He specifically told me mental health.
Okay.
And he didn't just tell it to me. He told it to.
Well, that's what I said, and so we're not getting. We're going to go.
That's why I asked for percentages. I want to know how many kids is being seen. Period.
I'm going to make an appointment And we're going to go, Missy and I will go back across there and see if we can talk to them again and find out.
I really
where-
suggest you meet with Lynn Hassenbola, who's the director of the
Okay,
Fins.
that's fine.
And she's on this side of the river at LeBlanc Special Services. She'll be glad to meet with you. And,
Oh, great.
So
Okay.
we'll be glad to find out. And if they need additional
Right across the river.
services, we're happy to provide them.
All right, thank you, Susan.
Sure.
We'll find out why, like I said, one of the reasons we rented them the space in this building is they said they needed the space to have their clients see a counselor. So that had a lot to do with us renting them the 2 offices in that building. And I really didn't know anything about it, and I still really don't know anything about either one of the programs other than what we have discussed here. But we talked to them, and they said every child had to go through an evaluation by a counselor. They didn't necessarily say they were going to need mental health, but they just said every child that they see had to have an evaluation. And that's what I'm
And
trying
that's
to
why,
find out.
that's one of the reasons why I forced the issue about the parish having an employee through mental health at that building, not 1, 2, 3, but 5 days a week. I tried to get someone over there to see these people. If a child come through there, who gonna see him?
Well, they can make an appointment.
You know, which is just not. Let me specify something. It's not a walk-in clinic. Before that come out, okay?
Yeah.
We know we have to have scheduled appointments, but we also know there are also emergency cases. Okay, so we need to look into that as far as a worker being there when they're supposed to be there, caseworker, because if someone come in there, then what's gonna happen? If
We
they don't
we
have
don't
that, if that's
handle
their only need
emergencies,
is
Mr. Butler.
transportation.
We don't
You know.
handle emergencies. We send them
That's
to the
not what I'm
emergency
saying.
room.
You're missing my point. You're missing what I'm saying. Okay? What I'm saying is, if a child come through there, there's no parish worker there, need to see someone to be evaluated. The word I want to use, evaluate. Okay. It could be a Monday. We don't have nobody there. They're going to want to schedule an appointment. What if that child make an appointment and can't make it? Then we done lost one. You see what I'm saying? That's my point.
I follow you.
That's what I'm saying. Which the state can pick it up if it's legal for them to pick it up. You know, if you understand where I'm coming from. That's why I've tried to keep the building open. We don't know who's going to come in and out that building, which is not a walk-in clinic. But some people might be afraid to know their diagnosis, you know, so I just try and make sure it's working properly and make sure that we can get the building open as more than it is now, you know. And if it's overturning numbers where we see a problem where we're not, well, the first thing comes out is that we got people over there, but they don't make the appointments. Well, that's what telephone's for. That's what you have a vehicle for. I mean, hey, go out and get them. That's the way I feel about it. I'm sorry. I mean, they need the treatment. We got the treatment there for them. We got to do what we got to do in order to make those people aware of what's going on. Things is happening too much in this area, across the river, and everywhere else, and nobody knows the situation of the problem. Maybe we can be one of the ones that can solve their problem by giving them the treatment they need. Thank you.
My next point is clinic collections. We got a fairly large check from Medicaid. They had been underpaying us October through April 2007, October 2006 through April 2007. They had underpaid for their services. So we're in the process of trying to go back. We have 10 pages of 6-point type client names. We have to go back to every account, to every transaction, and post the difference and straighten it out. So we'll have it all done hopefully in the next 2 weeks. They're working about 3 or 4 pages a day to try to get this done. We didn't make a mistake. They made a mistake. So we're going to get this straightened out, and I'll report more next month. Under grants, one thing I just want to mention that's related to something you all said earlier about capital area. I got a call from, I'm sorry, I don't remember who it was at Capital Area who called me, Mike Steinkamp, I think, and said that they would be making about the same size treatment grant as they made last year, $60,000. And I complained that that really wasn't enough. We had asked for about 30% more, I think, for this year's grant, and explained how we would use it. And he said, well, that was the same as Point Capima gets, $60,000. And so I tried to explain about the difference in our population. They have 23,000 roughly people. We have closer to 100,000. I think Sunday's paper said 97.5 something. And so I emailed Dr. Kosofsky and asked her if she would reconsider that amount in light of the differences in our population. She emailed me back and thanked me for my concerns and said she'd see what she could do or she'd consider it. So we haven't heard anything back yet, but we were very disappointed. We really we have just about the smallest award in the 7-state area for substance abuse treatment. So again, we were really disappointed. We had worked hard on our proposal, our request for increased money.
Okay, question.
Yeah,
Under
sure.
what grant was that? Prevention or
It's
treatment?
it's capital area, and I refer to it in my notes as capital area treatment grant. We have a separate capital area prevention grant
right.
for
So
30.
This is the treatment grant that you just
Right,
spoke to us about.
33,000 or something like that. That's going to stay the same as far as I know.
Excuse me, since you're on grants, I hate to bring it up, but I have to because it was brought to my attention about a week ago. What grant that was we had applied for that we hadn't received that we had, and we want to know why we didn't reapply for some programs in Donaldsonville. That grant there, well, the minister, some guys, some of the pastors in the minister allowance, and the mayor, I think the mayor received a letter from you stating the reason we didn't, but he said the way the letter was reading is like he was confused. I didn't see the letter. I think we had a copy of it, but the minister allowance didn't receive any.
I called him.
Well, they told me they haven't
I
heard
dealt
from
with
it, and
Reverend Ford, I think is his name. I have to look
just
at my...
one. He got a whole bunch of them. Whoever
Yeah,
you
but I
met
dealt
with.
with one particular person was my liaison, and I dealt with him. I'll have to check my records to see whether
Because they was asking me why it wasn't received and why nothing never moved
Oh,
on it.
no, we notified them right away when we didn't get the grant. We were disappointed that we didn't get it because we had too small a population in Donaldsonville. The grants that were awarded were, I think I estimated we would serve 50 people a year. The grants that were awarded served 350 a year.
Well, things like that, Susan, why we don't try and go out and recruit to find the problem?
Find problems?
Well, I say find the problem, why our numbers are so low.
Our numbers aren't low. Our numbers are consistent with the use of mental health services in the state of Louisiana.
No,
I don't
Jerry,
think at
excuse
that
me.
time there was a needs assessment done to determine the number, because we all believe that the number is much greater than that
Oh,
was
it's
applied
way.
for.
I know what I'm saying because
on the grant.
all these people keep coming to me saying.
Well, we're
they can't
talking
get
about two
service.
different things. Need and service assessment, service usage are two different issues. I'm not debating that there's a need, but the use of mental health services in the state of Louisiana is low nationwide. We don't compare with the rest of the country.
Well, my question was to you
much-
was that why we didn't receive the grant, and
We
you told me
didn't
due
receive
to
the grant because we didn't have enough.
numbers.
Numbers,
That's what you're
yeah.
saying, numbers.
We only asked us to treat 50 children.
And we
That's
didn't have
less
50.
than one week in a year for a $300,000 grant. And I think we could have offered to serve more than 50 children.
Well, we can't say we're going to serve. We have to serve the number that we estimate. So we have to be very careful. You can
No,
go
we're not
over
telling
that
you to
number.
Do nothing illegally. We're not saying that.
We just believe
I'm
there's
saying
more
that
than
Yeah, but
I
it's
know
not
it's
your
more than 50
name
children.
on the bottom line. If I say we're serving 50, we serve 50, or more than that.
No,
but
that's
we have
what
to
I'm
meet
saying.
the
But
minimum.
I mean, I'm not saying that. I'm not telling you to do anything illegally. I mean, by that statement you made just now. What I'm telling you is that I know right now I can go pick 35 people need services right now,
Okay.
and I can't see how we couldn't get 50.
The difference is that child and that parent, are they willing to come and get the services and go through the whole program? That number was based on completions, not on the number of people who would come into the program and not complete. So to make 50 completions, we would probably have to deal with 75 or 85 people coming in who would drop out because there's a dropout rate. So
Still, I don't.
we tried very, very hard and looked at everything possible, but
Couldn't
I
it be that
certainly am
hard for
open to
50 people?
suggestions.
It couldn't have tried too hard for 50 people. I mean, that's a different if you'd have said 500.
We're only talking about adolescents of a certain
I
age and a
understand.
certain problem. You know, there was specific. I don't think you read the grant. There were
Yeah, I read it.
specific
Yeah,
characteristics
but that's
that the
why I'm
person
asking
had to
questions, because I read it and I'm bringing it up again, you know. But I mean, this is some questions that I need to know to give some answers to some people. So I want to make sure I get the right answers to bring back. But I'm kind of confused. 50 people, $365,000.
Well, I gave a copy of the grant to Mrs. Gautreaux and to Ms. Baptiste, so they can give you a copy and you can look at it. I'll be glad to
that's
answer
not what
any
I'm
questions.
saying. You're missing my point. I got a good understanding. Okay, I understand that. My thing is 50 people. That's what I'm based on. 50. That's what I'm looking at. 50 for the amount of money that we could have had in that building, helping people. That's what I'm looking at. 50. So how many we did have?
5, maybe.
5?
Adolescents between 13 and 15 who came.
That's the number one impact right there.
Yeah.
You
But they
probably would
don't.
have been overwhelmed.
Having the problem again and coming and getting the service are two different
But
things.
that's what I'm saying.
Right.
Stuff like this happen when you ain't open but twice a week.
Okay, that's fine. with me.
That's the bottom line. That's the bottom line. So, Mr. Talia, that's the reason why, I guess.
Oh, I understand it fully. I think that we could have well served more than 50 children, and I think more than 50 children from that age. That's why we asking
at
for
that
this
age.
needs assessment, and we're going to see it through, and then we'll have grounds to stand on. Right now,
That's not a hard age to deal with. 13 to 15, that's right where we want to be at.
The needs assessment will tell us.
yeah.
Mm-hmm.
It'll give us some
So-
concrete
Correct.
facts on what the numbers really are.
So in the future, as far as the needs assessment, Ms. Renda, if it's possible, if that grant still would be in access in the future? You
I'm
think?
really not sure if that grant
There's
is
something
still
like
available.
$5 million and something grants out there for mental health. I pulled it off of the internet. There's way more grants available in mental health and substance abuse, and why we can't find any that we're interested in, I don't understand. But after we get the needs assessment, we find out where the children need our help, how many children need our help, how many adults, how many substance abuse, and all other information that this needs program has to tell us about that we really don't know. We need their help. Then we will be able to start this program up, okay?
Okay. These meetings are open, right? So some of the kids' parents, if possible, next month, if I can get it lined up for them to come and let them explain the situation in front of you. I mean, if it comes to that, that's what they're going to have to be,
We understand.
you know.
Madam Chairman, I know one of our number one problems is we're working on the needs assessment. Also, we need to look into transportation. That seems like the second biggest problem that we're having.
Before you go off on that, I don't have anything else from our report, just that the facility, the quotes for painting Donaldsonville just got yesterday, and they're in your report. Is there anything else? Any questions anyone has? Thank you.
Okay, let me see.
What you were saying about the transportation?
We need to look into transportation for the patient. Ascension Parish has a transportation system and all that, and I have read about it. But we're going to have to coordinate just better to get it over there, and we're going to have to apply for more grants. We can't just depend on one grant.
Yes, we need to dwell on the transportation, but when you call in the Gonzales office and they're telling you you got to come to Gonzales, you still have a problem.
I'm sure.
You know?
I'm sure all that's going to change.
That's what the problem is. You
Yeah,
know, they're
that's
being
gotta
told
change.
one thing over here, you know, and we have a whole building in Donaldsonville. You know, that's I'm confused on that. You know,
And when I say
We'll have a
transportation, I meant
we'll
for
have a
Donaldsonville.
work session, okay? Call a
Well-
work session. We'll call a work session next month. Okay, then we need a motion to approve the DA's invoice.
Motion to approve the DA's invoice.
A second.
budget report, Miss Celeste is not here. I quickly went over it. We are still being charged for tires, car washes, lubes, and what have you. So I'm going to have to take time and go over it line by line. Sorry, fellas, I haven't had time to do that with my appointments with the parish president and stuff. So under old business, we did the needs assessment. That's what we need to bring up. Miss Renda?
Okay, I did speak to Ms. Cologne with Robert Rose Consulting today, and she received the contract from the parish. She has signed it and is returning it and expects to start the second week in July. So I'm sure she'll be contacting you, Susan, and beginning that work.
And I, going through my paperwork looking for information for the parish president, I came up with these papers who states how many counselors was here, the number of patients, the different kinds of committees and groups and stuff that we had, and whether we have them now or whether they were just in the past. I really don't know what year these newsletters are for, but I'm going to give you that to take and let them look
Right.
at it. And it might be repeat stuff, but I think it was some good information there.
I have one question. Do we have any idea on after-hour calls? Is that anything that gets tracked after hour? Okay. Does it just referral to crisis line or something is what is on the for after hours?
Okay, Mr. Jerry Butler with your Donaldsonville report.
Me and Brian went out for the to meet with the contractors on pressure washing and repainting the Donaldsonville building. The quotes should be in your packet. We need an approval as far as what needs to be done, which one we want to go with to get this done immediately. But before we approve this, I have something on the old business I need to bring up. I remember the other meeting
Excuse me, our quotes, where did you say our quotes?
in the
were?
back of the
In your packet, Ms. Susan.
in your packet.
You need more?
I
We
didn't look
discussed
at
and we changed the name of the Donaldsonville building, and we need to contact Celeste and the what's her name that does the for the quotes or whatever it is. Yeah, to see about getting because we should have. I'm thinking we should have put it in this bid as far as taking the one down that's on the building, but I didn't think about it until we was actually saying about that. Me and Brian were looking at it and said, well, what are we going to do with the name? I mean, they're pressure washing it already. They can remove it, but
Yeah.
it wasn't in the quote. So whoever going to put the other name back on the building, we need to look at.
Well, could we maybe call the company that we approve and ask them how much more they would cost just to take it down and leave it down till we go through the budget?
Well, then we're going to be going back through all this paperwork again. Just let the people. I would suggest let the people who are going to put the sign up remove the one that's down.
Well, it's not going to interfere.
It's not going
with
to
the
interfere
painting or
because
whatever?
no.
Oh, okay, fine.
It shouldn't. It
That's
shouldn't
good.
interfere
Very
because it's on the bricks. All they're doing is pressure washing the bricks.
Very good.
They're pressure washing the bricks and the undercoating.
I really
We
do.
just need to find out when somebody that makes signs will be able to come out and look at it and see the correct, what we have talked about as far as what the new name of the building is going to be. So I would like to make a motion to accept the lowest bid on the quote for painting, pressure washing the Donaldsonville building.
And who's the contractor?
I'm looking right now.
Acadian.
Acadian and Builders and Construction, LLC, contractor.
Would you make a motion with that in it?
I would like to make a motion that Acadian Builders and Contractors, LLC, will receive the job on the painting of the Donaldsonville building.
I'll second that.
Any objections?
I thought we was going to have a problem with it because when I checked the map, I said I hope we wasn't in the historic district, because then you would have to go through
All
the
kind of
city
things.
as far as choosing a color and all this and that. But when I contacted the Mayor Sullivan, he said that we wasn't in the district, that the contractor's going to have to call the city hall and do their licenses and what's not in order to start the job. So,
Okay.
well,
No
where you want to go?
objections, the motion passed to accept the bid on getting the building power washed and painted. Anybody else having any business?
What are we
Under
going to do
new
but the, before we go to new business,
Oh.
but the purchasing of the sign? What we going to do about that?
We're going to check the budget and see if we
Right.
got it in the
Well, you
budget.
just have to make a motion that you put that out for bid. You know, if there's something that has to be done or purchased, I mean, we have to motion that, that a bid is put out.
And that was not included in our
Or,
budget last year. We have changed the name in the middle of the stream.
We changed the name of that meeting we had.
well,
Yeah, but that wasn't in last year's budget. And this year's budget's going to be coming up real soon. So we can get a bid, we can put it in the budget. And we may have some monies in the budget to do this. If
So
y'all
we
want
wanna
to
wait
go ahead
until-
and if you want to go ahead and
I
ask,
tell you what, let's wait. I mean, this is my suggestion to you all. Let's wait until the outside of the building is done, and we still got to get the inside painted.
okay,
And maybe we can send both out at the same time.
so
Very
we'll
good.
make a motion to, look at that at a later date.
thank you.
All right, I'll make
Okay.
a motion that we do that.
I'll second.
Thank you. Okay, ladies and gentlemen, we need a motion to adjourn if no one has anything else.
One question.
Sorry.
What about the inside paint job of the building?
Inside paint job or what?
The Donaldsonville building?
What about it?
What about it? Are we getting it painted or not?
Wasn't that part of what we just said we would do that whole
Yeah,
thing?
yeah, yeah.
at
We're
the
gonna wait till the
once?
outside is done. And
And we
jump to
would
the
get,
inside.
do it at the same time.
That's your
as
that's
we
your
get-
opinion. If you want to
I just asked
jump
a
on it
question.
now.
I thank you for the answer. Madam Chairman, I motion we adjourn.
I'll second.
This meeting is now adjourned. Thank you.